A normal menstrual cycle usually lasts for 28 days, but it can range from anywhere between 25 days to 35 days. When a woman is having a normal menstrual cycle, then usually they tend to ovulate 14 days before the onset of next menstruation. The onset of menstruation will be counted as a day 1 of the period. So that means that they have a higher chance if they have intercourse between day 8 to day 19, either daily or alternate days, because the egg is most probably released at this time. And the egg is going to be alive for 24 hours in a female reproductive tract. And the sperms are going to live for 3 days in a woman's body, and sometimes even up to 5 days. So if a woman is going to have intercourse from 5 days prior to the egg release or on the day of ovulation, the chances will be better. So how do we find the fertile period if you don't have a regular cycle? If you don't have a regular cycle, it's very difficult to find because we don't know exactly when she is going to get her periods next. So in that case, you have to come to the doctor and you have to do either ultrasound scans or some hormonal tests to find out whether they are really releasing the egg. There are some other methods to find out the fertile period too. For example, the cervical mucus, which is a slimy mucus produced by the neck of the womb, which is the cervix, will be more just before the ovulation, and it will be thin and slippery. After the egg release, this mucus will become thick and tenacious. So if the person is trying to have intercourse during the time of excessive cervical mucus production, which is thin and slippery, the chances are better. And there are some other things like basal body temperature, which is not very much reliable because just before the egg release, the body temperature will rise to 0.5 to 1 degree Fahrenheit, and it will be persistent till she gets the period. But this basal body temperature measurement is very cumbersome because every day before they get out of the bed, before doing anything, before drinking anything, they have to test their temperature every day, so that they will make out exactly when the body temperature starts to rise. And when the body temperature rises, it will actually tell us whether the egg release has happened or not. It will not tell us whether the egg release is going to happen or not. So we will actually most probably will miss the bus. And so these are the like clinical things which the patient herself can notice. There are some of the hormone tests called LH kit, which actually holds good for patients who have regular cycles. A kit maybe contains some 5 to 7 test kits, so we can actually use it from day 8 or something, and we can test it daily. The urine has to be tested with a kit, and if this line comes, like 2 line comes, which is a positive sign, that means that she is going to release the egg within another 24 to 36 hours. So they can predict the ovulation and they can have intercourse around that time, which will be helpful to them. But this LH kits are not completely reliable, though it can detect 90% of the times the egg release. Sometimes it can even miss in conditions like polycystic ovaries, where the patients already will be having high LH, and there are some other, maybe the test kit failure. There could be some other reasons also. If you are more than 35 years of age, instead of trying various methods or instead of doing the fertility tracking, it's better to seek professional help so that you can try to become pregnant at the earliest.